Hello friends, today we are going to discuss about right to access for mental health care under Mental Health Care Act of 2017. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. If you want to have a legal opinion, please do contact an advocate. This presentation is not a substitute for legal opinion. Conflict of interest? None. The objective of this video is to discuss the right to access for mental health care, that is Section 18 of Mental Health Care Act of 2017. The target audience who are going to benefit by this video are doctors and psychiatrists, mental health professionals, persons with mental illness, family members of persons with mental illness, mental health review board members, state mental authority and central mental authority members, and advocates. Let's discuss about right to access for mental health care. If you look at the Constitution of India, the legislative powers have been divided between the state and the central because it's a federal structure. If you look at the health is a state subject. That means it falls under state list. So the state is going to make legislation and it has complete power over the health matters. And however, it has been placed again in the directive principles of state policy. So this is regarding the state with regard to health. But however, when you come to the mental health, it is placed in the concurrent list. That means both central government and the state government have the power to legislate. So it has been in the concurrent list, it is called as lunacy and mental deficiency, including place for reception or treatment of lunatic and mental deficient. Although these words looks very old, but they are part of our Constitution of India. So remember, mental health falls under concurrent list. Both central government and state government can legislate. Hence, there was a new law, Mental Health Care Act of 2017, was passed on 7th of April 2017 by the Parliament of India and received President assent also. What was the need of this legislation? The need of the legislation was very clear. As you know, recently in COVID, there was the issue between the power struggle between state and center with regard to health. It may be regarding vaccine, it may be resources sharing with regard to health, or else with regard to drugs. So the center used to say, the health falls under the state subject, the state has to take care of their citizens. But unfortunately, in a country like India with 138 crore population, many of the state do not have so much of economy to invest in health. Hence, some states, if you look at their health indicators, they are very poor. And also, they have not invested in health. This forced many citizens to move from one state to another state in search of good healthcare services. And the healthcare services of those states are finding it difficult to provide care to the people who are migrated from other state. Although the country like India says there is a freedom of movement and they can move from one place to another to get services for health. But however, certain states are investing in health and certain states completely ignoring the health. But when it comes to mental health, where the persons with mental illness are unable to defend themselves, they do not know how to demand for healthcare services. In such a scenario, placing mental health under the concurrent list makes a very important point. So the Constitution of India, the people who have drafted, placed mental health in the concurrent list. Hence, the center and the state both can legislate. So whenever there is a conflict and the center legislation takes over the state legislation. So here, the Mental Health Care Act was implemented with a clear mandate. So it has been clearly depicted in the preamble. If you look at the preamble of Mental Health Care Act is very clear. It says, the act to provide mental health care and services for persons with mental illness. That is number one. Number two, to protect, promote and fulfill the rights of persons with mental illness during the provision of services. So these are the two important objectives of the Mental Health Care Act: to provide services, to protect the rights of a person with mental illness during the provision of services. With these two important objectives, this legislation was implemented by the center, and now the state also has to follow. Let's look into why this legislation becomes very essential. The heart and soul of this legislation is the rights which have been enumerated from section 18 to 28. These are the mental health rights which have been bestowed on persons with mental illness. And this is the heart and soul of this legislation. If you look into it, section 18 is the brain of the whole legislation, if you ask me. That is, right to access for mental health care. Section 18, right to access for mental health care, under subsection 3, it clearly says there should be a range of mental health services should be made available in the community health centers and upwards. That means from tehsil hospitals to district hospitals, medical college and mental hospitals. Here, the ranges of services to be discussed. I'll come shortly to the ranges of services. But at the same time, it says the mental health services should be integrated with the general health care services. That means it should be available in the community health center, it should be available in the district hospital, it should be available in the medical college. That means you cannot segregate. You have to provide mental health care along with the general physical health care. Now let's discuss about the ranges of mental health services that should be provided. Right to access for mental health care, the ranges of services should be provided are here: outpatient mental health services, inpatient mental health services, child and geriatric mental health services, emergency services, halfway homes, sheltered accommodation and supported accommodation, mental health services to support the family of persons with mental illness, home, hospital and community-based rehabilitation. Look at the ranges. The range starts from outpatient services, inpatient services, child and geriatric. At the same time, it talks about rehabilitation and also to support the families of the persons with mental illness. So what a beautiful, idealistic right to access for mental health care has been drafted. At the same time, section 18, subsection 5b also says, provide treatment in a manner which supports persons with mental health illness to live in the community and with their family. That means you should not provide services so that the patient is removed from the family. You should enable the services in such a way the patient remains in the society along with the family members, and this right to access for mental health care should be provided. And further, it also says treatment in mental health establishment shall be used only in exceptional circumstances for a short period and as a last resort. That means admitting a person with mental illness to a mental establishment should be a last resort, and it should be in exceptional circumstances, and it should be a very short period. That means it clearly says the services should enable the persons with mental illness to be treated in the community along with their family members. Further, section 18, subsection 5 clearly says that no person with mental illness shall be required to travel a long distance to access for mental health services. That means you are not going to start services somewhere around 300 kilometers where the patient stays, and from he has to travel 300 kilometers to access services. It should be near to the person's house. That means it should be available in the primary health care center and community health center. Further, and it also clearly says it ensures minimum mental health services should be provided in each district. What a beautiful way of putting across. That means these services should be available in district hospitals also, from community health centers, medical college, and also in mental hospitals. Further, if these minimum mental health services are not available in the district, so if that person avails services from private or any other agencies, that cost should be reimbursed by the appropriate government. That means reimbursement has been clearly planned. This section 18, subsection 5F is very clear. If the state disowns the mental health care services, this legislation clearly says if you don't provide services, you have to provide compensation or the reimbursement for the health expenditure the family and the person with mental illness has done. So, first time in the history of Indian Constitution, such a legislation has clearly brought in for health. And mental health is the only legislation here which clearly says if the services are not made available by the state need to reimburse if whatever the expenditure has occurred. What a beautiful way of putting across. Further, it also says section 18, free treatment should be given for the below poverty line card holders, they're destitute, and if they don't have any card and is a homeless mentally ill, treatment should be provided free of cost. As you know, severe mentally ill patient, they will be homeless, they will be wandering, they may not even have Aadhaar card. The family members are there, but the family members have neglected them. He is homeless, mentally ill, he will not have even any ID card. In such a scenario, this clause, that is section 18, subsection 7, clearly says if he doesn't have any ID card, also you should provide free services. Further, section 18, subsection 8, it also says that mental health services shall be of equal quality to other general health services. That means you will not say, because physical health is more important, mental health I will not give important. The state government is now mandated that the mental health should be in par with physical health with regard to provision of budget, giving importance, time, and various other expenditure. At the same time, it also says essential drugs should be made freely available from community health center, district hospital, and medical college. This essential drug list has already been notified by the central government on 16th August 2019. The list is available online. Those medicines should be available free of cost. Not only allopathy medicines, Ayush medicines have also been notified. These should be made available in the community health center, district hospital, and medical college. Further, to ensure that necessary budgetary provision in terms of adequacy, priority, progress, and equity are made for effective implementation of the provision of this section. This means every state now has to invest in mental health. It is a right. It's not a just direct to principle of state. We don't have money, we will not invest. They cannot say that. They have to invest in mental health care. That's what section 18 clearly says. To conclude, my dear friends, Mental Health Care Act of 2017 has brought in a paradigm shift with regard to healthcare services. Every state now has to implement Mental Health Care Act, and they are bound to provide access to mental health care under section 18. And if they don't provide services, they have to provide for the reimbursement for the expenditure if they have traveled for a long distance to get those services, or if they have availed services on private. So what a beautiful legislation, Mental Health Care Act of 2017. Thank you very much for giving your valuable time. Stay safe.